First News with Keeler in the morning on WIBX and WIBX950.com.
Without the ones like you, who work tirelessly to keep things running, everything would suddenly stop. Hospitals, factories, schools, and power plants, they all depend on you. No matter the weather, emergency, or time of day, you're the ones who get it done. At Grainger, we're here for you with professional-grade industrial supplies. Count on real-time product availability and fast delivery. Call, clickgrainger.com, or just stop by. Grainger, for the ones who get it done.
Dr. Kent Hall standing by on the line right now. Dr. Hall, good morning. Oops, I got to hit this button. Good morning, Dr. Hall. Sorry about that.
Morning. How you doing?
Good. Let's start with your numbers have been relatively low, but we did have a COVID issue yesterday. Where do you guys stand now?
Yeah, so we bumped up. As of yesterday morning, we're up to 25 patients.
Interesting.
So that is a bump up. And if you look across the state, I mean, the Buffalo area has been, trending upward pretty significantly for the last month or so. Over the last week, there's been a trend up in the Syracuse area as well.
So I know we're one of three of the top increases in cases. One of the three in the state, and our numbers haven't gone up that high, but it does seem like we're going to see a bump either today or tomorrow from the county numbers because of this Whitesboro situation. Whitesboro schools went on all remote today. What we're hearing, Doc, is that this came from extracurricular activities, including a dance competition, and it goes back to spring break. So somebody went to Myrtle Beach, contracted the virus, came home, didn't feel well, went to dance practice, went to the competition, and now you have over 36 dancers as of last night was the number I was given. These are unofficial numbers, but over 36 dancers between Whitesboro, New Hartford, and Clinton that have now tested positive, and we're talking younger demographics here.
Yeah, these are young people, and this is this is exactly what we talked about during that time, that people need to be smart, because if you're not, then these could become hopefully only mini super spreader events, not maxi super spreader events. But that's what we were concerned about with spring break, and it sounds like that may be actually what's happening. So. And
the interesting part of all of this is travel. In 1918, when the original pandemic occurred, it was travel that spread that, right? Military travel is how it's believed that it started. But travel is nothing like it is today.
Right, and that's it's all the more reason why it's so important to be doing the things, the relatively simple things that we know actually keep people safe.
All right, I want to start out with Chad in Holland Patton, who has a question. Hi, Chad. You're on with Dr. Kent Hall.
Hey, Dr. Hall. Yesterday you said that if you're vaccinated and you come in contact with someone who tests positive, that you don't need to quarantine. However, it's not like the virus hits you and dies. So why is that you don't have to quarantine?
So the recommendations and the requirements from New York State DOH are just that if you have been fully vaccinated and it's greater than 14 days since your last vaccination, then you do not have to quarantine if you come in contact with it. So this is what we know about the vaccination effect, that it has a positive effect not only on the body's ability to basically fight off the infection or keep the virus from affecting you from a systemic standpoint, but there are also increases in the amount of specific antibodies that are in your nasal cavity that actually keep it from gaining a foothold there. So it's not just the systemic effects; it's actually the local effects. So that's probably why they're saying that's true.
Okay. Did you?
Hold on, I did here.
That is interesting. That was a CDC recommendation, right?
Yes, it was a CDC recommendation that New York State DOH adopted.
Okay. And then the other thing was a lot of these schools have. I was reading something a physician was talking about. A lot of the schools have the plexiglass dividers that they've invested so much money in, which have been awesome for the plexiglass provider, the plexiglass divider providers. The plexiglass divider providers are doing really well these days. But this doctor says they're the only ones benefiting from this. This will not protect your child from spreading or catching the virus. What are your thoughts?
So, to the extent that they, keep people socially distanced and do provide a barrier where, as you are in the cafeteria eating and obviously you don't have your mask on, so there are small droplets that are coming out when you're breathing, and certainly when you're talking to your friend across the table. Some of those are actually going to accumulate on the plexiglass, which means that they're not in the air, kind of floating around, waiting for someone to bring them in. And as long as the plexiglass is then cleaned appropriately, then they actually should result in some benefit.
The reality is some benefit, right? The fact is, if you're in a room that doesn't have great ventilation and is medium size or even small, there's a chance you're gonna spread the virus that way, right?
Yeah, nothing is 100%.
Yeah.
The masks are not 100%. The plexiglass dividers are not 100%. Nothing is that. Which is why we need to do multiple things. We need to wear masks and we need to social distance.
Yeah. And if I remember correctly, the CDC's recommendation was that students wear masks all the time in classrooms, right?
That's correct.
Yeah, that was their recommendation. Somebody asking back, you talk about the pandemic of 1918. What were those long bird-looking like contraptions that physicians and medical staff wore back then?
They were basically ways to filter out, think of them as ways to filter out air, because as you breathed in, the air kind of came in through and any material, had the opportunity to actually accumulate within it, so it didn't actually make it all the way to the person.
All right, Monaski.
Okay, this says, my daughter's in Whitesboro School District. There was a positive test in class Friday. I received my second shot yesterday. Do I need to quarantine?
So, according to CDC and Department of Health, yes. Well, first of all, you are actually. Let me take a step back on that. So, your daughter has been exposed, but she does not test positive, is what I'm assuming, which means that you do not have to quarantine because you have not been in contact with somebody who has tested positive.
Had his daughter tested positive, he would have to quarantine.
Yes, if it's been less than 14 days after your second vaccine, then you would still need to quarantine.
Okay, all right. It's been less than the 14 days. After the second, all right. But again, that vaccine is your ticket to freedom. I can't stress enough the fact that we are now looking at. I just know, based on speaking with people that are working. I was out of the county over the weekend at the Griffith site. I know you guys have open appointments. People need to get this thing done, and it spells freedom for yourself, but also protection for others.
No, that's absolutely true. And we do have, at our vaccination pods, we do have open appointments. And my understanding, to your point, is so does the state and so does the county. So wherever you can get this, you should be getting it as soon as possible.
All right. Any thoughts on Whitesboro?
Only that this is something that we probably could have predicted in some way, shape, or form. Not necessarily this particular thing, but the fact that, they were going to have these outbreaks related to activities that went on the end of March and earlier this month.
And part of letting your guard down is when you're feeling ill, still going in and whether you're at rehearsal or whatever, if you don't feel well, be cautious and don't get out there and spread it.
Yeah, I can tell you, I'm sure all of us have, felt not well and ended up going to work or doing something because we say, oh, it's just a cold. In this day and age, right now, that's not the thing to do.
Doc, thanks. We'll talk again tomorrow.
Thank you, everybody. Please be safe.
You do the same. Dr. Kent Hall, MVHS.